Today, we welcomed a new patient, Luiza, to our clinic. She came in complaining of persistent pain in the lumbar and cervical spine. As an artist and makeup artist, she spends most of her time hunched over or bent in unnatural positions, which has resulted in chronic strain and discomfort in her back. She mentioned that although she occasionally receives relaxing massages, she finds it difficult to locate a skilled manual therapist who can provide both effective realignment and safety. She reached out to us by phone and scheduled a session. I hope to be the one who earns her trust and helps alleviate her discomfort. As a quick reminder to our viewers, we offer manual therapy training sessions, and we've now integrated elements of therapeutic physical training into the program. You can find all the information about our courses, appointments, and contact details on our website. Before beginning the session, we noted another concern. Luiza experiences jaw tension and symptoms of bruxism, especially after talking for extended periods. This creates additional strain in her craniofacial muscles. We began the physical examination with Luiza standing under axial load to observe how her spine and muscles react to gravity. From the back, we noticed a clear lumbar curve and rounding in the shoulders, indicating weakness in the rhomboid muscles. These observations were marked visually to monitor changes over time. We then tested the range of motion. During torso rotation, Luiza had more difficulty turning to one side. Neck rotation also revealed limitations, particularly due to muscle tightness in the sternocleidomastoid and scalene muscles. She reported tightness and slight pulling pain when rotating her pelvis, more pronounced on one side. After this assessment, we moved to the treatment table for a more in-depth evaluation. In the prone position, muscle tone was still high. Palpation showed increased tension in the quadratus lumborum and paravertebral muscles. She confirmed mild pain during palpation. We performed a preparatory massage to warm up the tissues. Luiza has a background in sports, so her muscle memory is active, but she still had areas of stiffness that required attention. After massage, the muscles became noticeably more pliable. We proceeded with lumbar traction. As expected, she experienced mild discomfort, but tolerated the stretch well. We alternated sides and monitored her response to ensure relaxation and avoid overexertion. Next, we moved to side-lying mobilizations. On both sides, we adjusted her posture and relaxed the lumbar and thoracic regions. Then, seated back to back, she crossed her arms behind her head, and we performed controlled thoracic decompression. We targeted the lower thoracic region first, allowing the upper spine to decompress more naturally later. Following that, we performed cervical mobilization and side stretches. Then, Luiza laid on her back for spinal decompression. She immediately felt release, especially in the cervical region, with slight sensations in the lumbar area as well. Interestingly, she mentioned that she hasn't fully regained her sense of smell since having COVID 4 years ago. However, she recently started perceiving the scent of roses, which may suggest a partial recovery. We then evaluated the hip joints. Her left hip had full range of motion and wasn't restricted. On the right side, we encountered slight tension, but after mobilization, it released with a soft click, restoring balance. We transitioned to a forearm-supported prone position and performed a gentle longitudinal stretch across the transverse processes. This helped relieve spinal pressure. Finally, we addressed her jaw. Luiza opened and closed her mouth under my guidance, and I carefully massaged the internal jaw muscles. Using a gloved finger, I released the tight masseter and pterygoid muscles from inside the oral cavity and externally through the cheeks. Though painful, the release provided noticeable relief. Afterward, Luiza reported a lighter sensation in her jaw and more ease when rotating her head. Her range of motion improved, especially in the cervical and thoracic regions. The spasms we identified at the start had significantly reduced. I explained that most of the pain she was experiencing was due to muscle and joint tension, not the bones themselves. We'll continue working on these areas gradually. She's now rebalanced and recharged. Luiza shared that she felt the joint tension had eased significantly and noticed better blood flow and lightness throughout her body. At the end of the session, we reassessed her range of motion. It was visibly better, and the previous tightness in her thoracic spine had diminished. She's done for today, and I'll be providing her with personalized recommendations. Thank you all for watching. Don't forget to subscribe, like, and leave a comment. See you next time.